Today I'm presenting a paper um, on challenges and diagnosis of acute febrile illness of bacterial etiology. Coming to introduction, acute febrile illness is defined as body temperature greater than 38 degrees centigrade for less than 14 days duration caused by diverse pathogens without any evidence of organ or system specific etiology. Enteric fever, strep typhus, and leptospirosis are the bacterial cause of acute febrile illness. To target clinical workup and treatment, the knowledge of local infections is required. Typhoid fever develops due to contaminated food and water. The major risk factors are poor hygiene and contaminated water. Strep typhus infections, leptospirosis are mostly prevalent in areas of heavy rainfall. The predisposing factors of leptospirosis are close human contact with wild animals or livestock and poor sanitation. In tropical climates, 10 or more per 1 lakh people are affected each year with leptospirosis. Strep typhus infection is spread by mites, which transmit Orientia susugamushi, the causative organism. Eschar is a useful indicator of strep typhus, which is present in only few patients. If early diagnosis and treatment is not initiated in case of strep typhus infection, it leads to multi-organ failure. Annually, about 1 million cases are reported in Africa and South Central America, with 1 million people contracting the illness. The most common people affected with strep typhus infection are agricultural laborers in the endemic areas. Clinical symptoms usually overlap, including fever, pain, abdomen, nausea, vomiting, anorexia, headache, and abdominal pain. Due to incorrect or delayed diagnosis, these infections lead to morbidity and mortality. The geographical environment and socioeconomic status and underlying illness influence the epidemiology of bacterial infections. The major cause of infections is the occupational exposure. This leads to early diagnosis and treatment based on antibiotic susceptibility pattern. The risk groups include farmers, veterinarians, meat handlers, and underground sewers. Identification of pathogens causing febrile illness by appropriate lab tests include blood culture. Serological investigation will help in diagnosing bacterial agents. Aims are to determine the bacterial agents among febrile patients. Objectives are to assess the clinico-epidemiological profile of acute febrile illness, to identify bacterial agents causing acute febrile illness with culture sensitivity with relevant investigations. Materials and methods. Study period was conducted over a period of 1 year from November 2018 to September 2019 in Department of Microbiology, Gandhi Hospital. It was a prospective observation study with inclusion criteria of patients for fever for duration of less than 2 weeks and temperature greater than 38 degrees centigrade, with exclusion criteria being to rule out viral and parasitic causes of febrile illness by investigations. Sample sizes being the 100 cases. And it includes the CRP kit. The methodology is by using bacterial blood culture bottles, 2 blood cultures 24 hours apart, received from ICUs and wards of medicine, pediatric, and nephrology departments of Gandhi hospitals, were further processed as per the standard protocols. These are bacterial blood culture bottles and bacterial 3D system. And the CRP kit and slide. The serum which separates after centrifugation of the blood was used for further investigation such as ELISA, Vidal, and CRP. And this is ELISA washer, incubator, and ELISA reader. So Vidal test kit and this is ELISA kit. This is a strep typhus ELISA kit. And the clinical profile of acute febrile illness cases are nausea, vomiting, dyspnea, diarrhea, jaundice, abdominal, pain abdomen, rash, which is Eschar, arthralgia, altered sensorium, cough, and headache. Clinical signs include hepatomegaly, splenomegaly, picturus lymphadenopathy. Statistical analysis was done by MS Excel Info 7. Statistical software package was used for statistical analysis, where t-test was applied to test whether differences between the mean values were significant. P values less than 0.05 was considered as statistically significant, P greater than 0.05 as insignificant. And observation and results. The study was conducted over a period of 1 year from November 2018 to September 2019 in the Department of Microbiology, Gandhi Hospital. All the blood cultures were received from the ICUs and wards from the hospital during the study period were analyzed. All the blood cultures were negative, and the serum after centrifugation is used for Vidal test, strep typhus, IgM ELISA, leptospira, IgM ELISA, and CRP. The Vidal test procedure showed TO titers greater than or equal to 1 in 160 and pH titers greater than or equal to 1 in 320. And the clinical profile showed clinical features with icterus of 29%, lymphadenopathy of 29%, pulmonary symptoms of 26%, hepatomegaly 23%, splenomegaly 19%, and Eschar 13%. And this is Eschar. And the strep typhus positive cases was most commonly seen in the months of July, August, and October, November, mostly in the rainy seasons. And strep typhus, this is the microbial titer. Leptospira positive cases were seen in the months of July, August, September, and October, mostly in the rainy season. This is a leptospira IgM ELISA kit with most cases observed in the rural areas. of 61%, and urban areas included 39%. And distribution of the bacterial cause of acute febrile illness, bacterial causes being 46%, leptospira 34%, enteric fever 20%, and the presence of Eschar and Streptococcus infection patients it was present in 6% in 46% patients. Discussion: acute febrile illness is a clinical illness which can be treated based on the detection of etiological agents. The causes are variable and require systematic approach to identify the cause. There will be delay in correct diagnosis of the patient due to non-availability of facilities to diagnose, which leads to death of the patient. Depending on the cause, the guidelines for investigation and antimicrobial therapy can be available. The aim of the study was conducted over a period of 1 year to determine the etiological agents of bacterial origin through blood culture and serological investigations. The study included 100 cases of febrile patients of bacterial origin from medicine, pediatrics, and nephrology departments, including wards, ICUs, over a period of 1 year. Many increased numbers of acute febrile illness cases were observed during months of August, September, October. Predominant notice in all the infection as they get exposed to outer environment. The study was carried out to describe the distribution of the etiological agents of acute febrile illness in the patients based on the hematological and microbiological investigations along with the clinical profiles. The study included 100 cases of febrile illness patients of bacterial origin from medicine, pediatrics, nephrology departments. And the spectrum of bacterial agents of acute febrile illness in various studies was in Garima et al., Kundavaram Paul et al., Yogendra Pondaram et al., Joanna Parita Fernandez et al., and present study in 2019 in Telangana, which was correlating with the Maharashtra, which is done in Maharashtra, with Streptococcus infection correlating of around 47%. And the distribution of the cases based on the age. Majority of the cases in the present study are adults under the age group of 20 to 40. In a study conducted by Kundavaram, Paul, Prabhakar, Abhilash et al., done in Tamil Nadu, bacterial cause of acute febrile illness among adults under the age of 40, and in a study conducted by Yogendra Panduram Shelke et al., done in Maharashtra, age group affected suffering from this infection was around under the 45 years of age. Distribution of cases according to gender. In the present study, affected with the illness were mostly males up to counting of 66% and females up to 34%. Then a study done by Yogendra Panduram Shelke et al., that is in Maharashtra, males were affected more commonly than females. In a study by Kausalya Kasturabchi, males were commonly affected than females. Various studies on clinical profile. In the present study, patients with acute febrile illness presented with fever, nausea, vomiting, breathlessness, anorexia, pain abdomen, diarrhea, lymphadenopathy, icterus, splenomegaly, hepatomegaly, rash. Hematological investigations include anemia, leukopenia, thrombocytopenia. Biochemical investigations include altered transaminases, raised bilirubin levels. Epidemiological profile: mostly people residing in rural areas are infected. Results of the present study among the acute febrile illness patients include Streptococcus 46%, leptospira 36%, and 34%, enteric fever 20%. Result of our study is similar to those done by Kundavaram Paul et al., Yogendra Pondaram Shelke et al., Abdul Roy et al., and Joanna Prerita Fernandez et al., which included of Streptococcus being most common bacterial agent among febrile illness patients. As Streptococcus is the predominant etiology in the study, thorough physical research of an Eschar is mandatory so that appropriate antibiotics may be promptly initiated. Streptococcus, leptospirosis, and enteric fever was identified as major cause of acute febrile illness. Various studies, there's Yogendra Panduranga Shelke et al., Rock et al., Joanna Prerita Fernandez et al. Showed similar results. Summary and conclusion: the present study challenges in a diagnosis of acute febrile illness conducted in the Department of Microbiology, Gandhi Hospital, which was done for a period of 1 year, showed most commonly included leptospirosis infection, Streptococcus infection, and viral test positive, out of which 66 were males and 34 were females. Males to female ratio is 2:1, and most clinical features were observed in all patients were vomiting, diarrhea, pain, abdomen, headache, and Eschar was seen in 13% patients. And age group included 20 to 40 were most commonly involved. Among the bacterial agents, Streptococcus was most commonly 46%, leptospirosis 34%, typhoid fever 20%. Patients suffering from bacterial illness mostly resided in rural areas. Maximum number of patients were observed from suffering from Streptococcus infection, lowest being typhoid fever. Conclusion: the study was based on acute febrile illness of bacteriology. Among these, Streptococcus, leptospirosis, and enteric fever were identified from the data collected of 1 year, out of which the Streptococcus was predominant. Finally, the bacteria identified based on clinical profile investigations in febrile patients through thorough protocol along the whole study were treated with appropriate antibiotics. These are my references. Thank you.